CCT HD is a state-of-the-art diagnostic color vision testing device that tests for both congenital and acquired color vision deficiencies. CCT HD uses a cone isolation contrast sensitivity method to assess the function of individual cone cell populations: L cones, red, M cones, green, and S cones, blue. Diagnostic color vision testing is an important measure of visual function, which is complementary to visual acuity, perimetry, and visual electrophysiology, as well as structural testing such as OCT and fundus photography. From a diagnostic perspective, we are especially interested in the acquired loss of cone cell function. The patient is required to respond to different contrast levels of 3 cone-specific Landolt-C targets. Persons with the ability to distinguish low contrast levels for each of these targets have normal/typical color vision. Contemporary eye care includes qualitative and quantitative assessment of functional color vision. Commonly used color vision tests such as pseudo-isochromatic Ishihara-type tests use confusion colors to identify red and green color deficiencies and have limited ability to grade depth of deficiency. Additionally, most pseudo-isochromatic tests do not test for blue-type deficiencies, which are rarely genetic and are more commonly acquired, affecting up to 15% of the general population. This important but often overlooked clinical sign may be caused by retinal, macular, optic nerve, trauma, or neurological disorders, in addition to cataracts and high-risk meds, as well as hundreds of common drugs and substances. You can find more clinical resources and scientific publications on our website, www.konanmedical.com, or contact support. Your CCT device will either be an all-in-one desktop PC or a tablet. Here's the test selection interface. On the top, we can select a monocular or binocular test. To perform a monocular test, select ODOS to test both eyes independently, or if you choose to test only one eye, select OD or OS accordingly. To run a binocular test, select OU. This screen displays concise instructions that should be explained to the patient. To ensure test accuracy, adjust the patient's position so that the eyes are level with the center of the monitor and is seated as close as possible to the user-defined distance away from the display. Place the 4-button response pad in a position that allows it to be used comfortably with the patient's dominant hand. Instruct the patient to depress the arrow button that corresponds to the direction of the opening of the C. The C will disappear after 5 seconds, and since the test is forced choice, the next Landolt-C will not be displayed until a selection is made, even if this is a guess. The demo area is responsive to the arrow pad, so that the subject may practice and understand the test process prior to starting a scored test. It is important to explain to the patient that not everyone will be able to see all of the targets. CCT HD is a threshold test and is therefore designed to present some targets that are below normal human color contrast threshold. A full threshold test takes about 7 minutes for both eyes. To start the selected test, select the green OK checkmark or hold down any arrow key for 3 seconds. During the test, the operator should both monitor the patient's progress and make sure that the patient does not significantly change position. The test can be stopped at any time by selecting the Escape key from the keyboard, returning the application to the Patient Test Instructions tab with the same parameters and patient selected. When the test is completed, the results will be displayed. Here is an example of a result generated by the CCT HD. There are multiple tabs for each test result, each of which has a help window that describes the content given. Click on the question mark icon to view this window. Click anywhere on the screen to exit this window. The Results tab offers an easy-to-view summary. The data table at the top lists contrast thresholds expressed as log CS, contrast threshold percentage, and score. These scores are displayed in a bar graph with candlesticks depicting standard error. Open circles are average response times indexed to right side scale. These values are also shown below the x-axis under each cone bar graph. The Details Notes tab features a table of summary data: final PSI determined threshold, standard error, average response time, cone contrast score, and category. General patient and test version data is also displayed. The next tab is the Trends tab. For cone contrast tests, A trends graph displays up to the last 6 exams categorized by OD, OU, and OS. Trends are useful for visually assessing changes over time. The next 2 tabs are used mainly for research. If interested, you may open the help window or contact tech support for explanation. Konan recommends to test all patients using the full threshold test for 30 trials on each cone, for each eye. This will yield the lowest standard error, which is important for trend analysis. A patient can start with a very high score, for example, 150, but due to an acquired condition, the score for that cone can have a significant change, but still remain healthily over 100. This change would not be detected using traditional methods of color vision testing, but is clinically significant and may be used to monitor or document a condition. Thank you for watching this video. We hope you found the content useful. For additional questions, contact us using the phone number and email displayed on the screen.